Earlier in the newscast, we talked about Vice President Joe Biden coming to Maryland with some efforts and thoughts to help clear up the backlog of rape cases in this state, probably something that could be a model around the nation. Joining us now to comment on the Vice President's visit to Maryland in the State Forensics Lab, of course, is Laura Clary. Laura is with an organization called SAFE. SAFE stands for Sexual Assault Forensic Examination, and you're at GBMC. Is that right, Laura?
Yes.
First, your thoughts about the Vice President's visit and this idea he has. Explain to our viewers who aren't quite familiar with it, please. How would it work?
So it's a great idea, and it is to provide more funding so that every rape kit can be tested.
Okay. And how expensive would something like this be?
It's very expensive. It costs a lot of money to process a kit, so that's one of the reasons why I think there is a backlog, is because of the amount of money that it costs just to process one.
From a criminal forensic standpoint, Maryland tends to be a leader in the nation for these types of things, does it not?
It does.
Yeah. And so as you look at it, tell me the process now. If a victim of rape comes in, which could be, and we should point this out, a woman or a man, is that right?
Absolutely.
Yeah. What's the process typically?
So there's a few routes that a patient can take when they come in. So a lot of times when they come in, I would say most of the time, they do come in when they're already accompanied by police. And police have already started an investigation, and actually things are going on behind the scenes that we don't even know as forensic nurses. Right. So at that point, then we would go in and we would speak with them, and we would let them know all of the options they have. Some patients come in without police, and at that point we also give them their options, whether or not they want us to contact police. Victims can actually make that decision. They can have a forensic exam without contacting police.
Right.
So once they make that decision, then we take them to a private suite that we have at GBMC, and we can perform these exams.
Right. One of the things I'm sure you'd like to discuss is we know rape is a crime of power. It's not about sex, and it's very traumatic to the victims, and I'm sure that's something that you're skilled in trying to walk people through. Is that right, Laura?
That's right. Yes, it is a crime all completely about power, and I think a lot of people don't know that. It's all about power and control that person has over an individual.
Right. So the Vice President's idea, what don't we have now that we would have in addition to the kits that would happen under his plan, basically?
So with this extra funding, we're going to be able to hopefully process more kits than we are right now. Okay. Because again, with the amount of money that it costs, they kind of have to pick and choose where they're going to be able to process these kits when they are. But thankfully, we have great police department. Right. That, you know, when a victim comes forward, they do everything they can to make sure that these kits get processed. Lastly,
I know you don't write the budgets, but this would be a combination of federal dollars, state, I would imagine, as well, Laura?
Hopefully, yes.
Yeah. Okay. Laura Clary, thank you so much for coming on today. It's a very important topic, and we appreciate your presence here today.
Thank you.
All right, absolutely.